Gentlemen, thank you so much for being here. I'm going to really let you lead this discussion and ask that we keep it in terms that are simple enough for people to understand. Dr. Markl, since you're the keynote speaker, would you like to lead the charge, and then we'll bring everybody else into the conversation? Tell us a little bit about your work.
Well, so I just recently moved to Northwestern University in Chicago, and I'm leading the cardiovascular imaging program there. In that role and during our previous research, we've developed novel imaging technologies that allow us to really look and understand blood flow in 3 or even 4 dimensions, as we call it. So the kind of key word, if you like, for the technology is 4D flow MRI, 4D, because it really covers 3D volumes of interest, like the entire intracranial vasculature over time. Time would be the cardiac cycle. We're able to interrogate three-dimensional or three-directional blood flow velocities within entire organ structures. And with this new data, we're now kind of able, or on the verge of being able to understand really how very complex interconnected systems of arteries and vein really works, how it's affected by disease, such as MS, and therapy. So that's kind of the basis of this work and this new technology we have right now.
Dr. Zamboni?
Yes, we now developed something new to screen patients with a condition called CCSVI, and this was presented today with a new plethysmography methods. So it accounts for a silicone color, very soft, so it can be easily used by patient of proper size with a sensor inside that give us a possibility to measure the blood volume in the neck and the variation of the blood volume according to the change in posture, for example, tilting very rapidly the subject from upright to supine and again to upright with a special chair. We are capable to see the dynamic of cerebral venous outflow according to the posture. What we found is that there is a deep variation, a significant difference between patients affected by CCSVI and normal controls, and with a very good sensitivity is the term. This is a term used for expressing scientifically the accuracy of a diagnostic method, and we found that this system is enough accurate to be proposed as a screening device, because it's very, yes, it's cheaper, it's completely non-invasive, very, very rapid, and of course the positivity to this test may give indication to our second or third level test. And also a possible potential use of this system is to follow up patient after procedure, endovascular procedure for CCSVI, because it's very difficult to monitor by MRI and by Doppler, because Doppler requires a long time, and this can be proposed as first level post-op monitoring, and in case of abnormalities, you may use the other test.
Okay.
So this is a promising technique, and we think to develop this and to spread this kind of assessment in the next years.
Dr. Haacke, do you want to speak to it?
So as Dr. Zamboni has said, this is initiated by our interest in chronic cerebrospinal venous insufficiency, or CCSVI. And there may be multiple sources of this. We've now seen that it could be a narrowing or stenosis of the major veins, for example. It could be, in fact, a congenital abnormality, a truncular venous malformation, where, in fact, a jugular vein might not actually form with the lower part, might merge into another vessel, or it could be due to bad valves, where the valves are not functioning properly, but in all cases likely leading to an intracranial problem. And the work that Dr. Markl is looking at right now offers the potential for us to study the flow under different circumstances in vivo for patients and for normals to see if we can quantify what is normal cardiovascular function in vessels and what is abnormal for MS. And as I presented today, what is equally abnormal in Parkinson's disease. And perhaps in the future we will find applications to other areas such as headache, maybe even dementia. But before we can really try to jump to conclusions of what the role of this is, we have to understand it from a computational fluid dynamics perspective. And I'm going to leave some of that discussion to Dr. Attariwala. But I think the critical thing here is that we have the potential to do the pre-screening that Paolo was talking about with plethysmography. We can also then follow up with ultrasound, and then we can follow up with magnetic resonance imaging to look at this data. And I think what's exciting today is that between all the people here, thousands of cases have been done. And in our case, we've just looked at trying to compare normals and abnormal patients such as MS and Parkinson's to see if there's a flow marker. And it may be that if the internal jugular flow is very low and most of the other blood that gets out of the brain has to go by collaterals and the vertebral plexus and highly resistive pathways, those things that may be leading to reflux, this may be a clear marker, not so much in terms of what we see anatomically, but the flow. And so our results currently indicate that if the total internal jugular venous flow is less than half of the arterial inflow, this may be a risk factor. And we also see that many MS patients and many Parkinson's patients have the blood flow carried out amazingly by only one jugular. Even though we see many other vessels present, they're basically not functioning. Well, this is a critical issue for us to investigate, but again may be a biomarker for us that these people are at risk for developing problems. So I think it's very exciting where we stand now in terms of being able to make these quantifications, and the next stage is to be able to pass this on to those experts who are looking at predicting what happens with this to see if our intuition, as Dr. Zamboni has suggested, that this abnormal flow may lead to a breakdown of the venous wall, may lead to iron deposition, and we know that happens, by the way, in Parkinson's disease, just like MS. There may be these integrating factors that we could actually then demonstrate would really happen. So we're at a very exciting time point now, integrating these technologies.
Dr. Attariwala?
Sure, thank you. I come from a bit of a hybrid background. About 20 years ago, I was actually looking at vein pressures in the eye. And as you know, the eye is the window to the brain. And way back then, nobody thought that the vein contributed anything to flow at all. Now we're seeing through work of Dr. Zamboni and everyone else here in this panel that that's not the case, that we are noticing now that veins seem to somehow have a very important role in how blood flows through the brain. There's some type of change that happens, we don't know exactly what, be it something like hardening of the veins, perhaps similar to atherosclerosis, just what we're seeing on the other side, which is changing. Basically, I think we're at the verge of a new concept in terms of what's going on in a lot of brain diseases that we've actually never seen before. And the reason we've never seen a lot of these before is because we've never considered the veins as being something important. And I think with CCSVI, what it's really doing is focusing or refocusing a lot of the scientific body on looking at veins. And that's where I come in, because I have a bit of a hybrid background looking at fluid mechanics, plus as well I know MRI technology inside and out. And now we have these unique tools where we can actually start to investigate these ideas that have actually never been considered before. So I think we are, as Dr. Haacke said, on the verge of something very, very big here.
Dr. Mueller, do you want to make a comment?
Yes, my name is Lucas Mueller. I work at the Laboratory of Applied Mathematics at the University of Trento in Italy. I'm a little bit an outsider here. We are working in our group with the numerical solution of partial differential equations, which are the equations which you study natural phenomena by mass conservation and momentum balance. And until now, our group has worked mainly with theoretical work. And we are facing now a real problem or challenge in doing this kind of investigation, since the modeling of the Venus system has been disregarded by the scientific community. In 1968, Transactions on Biomedical Engineering published the whole issue on modeling of the Venus system, but this was not enough to encourage research on that area. So that we are still facing a lot of problems of building mathematical models and numerical schemes to solve them. We hope to contribute in the future to CCSVI applications in hemodynamics.
Does anybody want to comment on that? Do you want to speak to that? Because it is a changing science, and some of the challenges that they're facing there are challenges that are being faced among all of the scientists because this is such a new field, right?
I think maybe one comment from the MR imaging side. I couldn't agree more with the fact that kind of venous imaging has been overlooked, particularly when it comes to the flow in the venous system. There has always been imaging that looks at venous anatomy, but not really at the role of the function of the venous system. And that seems to be, or is true, both for imaging but also for the modeling side. And I think we're really at crossroads here, or at the beginning of revisiting the venous system and understanding that there's actually quite a number of interesting facts or challenges about it. I mean, the arterial system is very well investigated. And you could then think, well, why don't we just apply the techniques we have for arterial imaging to venous imaging? Well, it turns out it's not that simple, because there's much more influence or impact of respiration, of patient breathing on the venous flow that has to be considered. We have to look at the different flow patterns that are in the venous system. It's essentially a low pressure system, whereas the arterial system is a high pressure system. And that ties very nicely into what was just said about the modeling. I think it's the same problem. There's very good models out there for the arterial system, but we cannot just simply apply those for the venous side. We kind of have to relearn how to study the venous system. And I think there's also a large role for bringing together the modeling and the imaging to really arrive at a much better understanding, not only at what we see by imaging about the data, but how do we really understand the biophysical properties of what we're seeing.
So then how do you do that, gentlemen? Because, you're all bringing a piece of the puzzle to the table. Dr. Zamboni got the ball rolling, and you're here, and you're in this very unique environment. You have an MR expert in fluid dynamics. How do you bring all of the pieces together to continue to move the ball forward?
One of the unique opportunities of what we actually have here, and the fact that you actually have basic science people who are doing modeling. We actually have imaging people who can actually now start to look at that imaging, and so we can actually start to sort of translate what was started in the arterial side and actually now take it to the vein. What we do know is that the venous side, as Dr. Markl mentioned, is far, far, far more complicated because it's a low pressure situation. All the advanced mathematics that we typically apply to the artery do not work anymore. We have to actually go all the way back to some very, very heavy science-based fluid mechanics and start with that and take these tools that we've actually developed with MRI and actually almost rejig them to look at this new phenomenon that's happening in the veins. And the potential for the clinical applications become enormous. Like MS may just be the tip of the iceberg.
I would also say that's what our venue here is right now, the International Society for Neurovascular Disease. Neurovascular doesn't mean veins, it means arteries, veins, and really the complete vascular system. So we have a whole story here about what's important and also the neural part, meaning how does this abnormal vasculature lead to neurodegenerative disease, neurological diseases. So I think the venue here has been wonderful. We've had experts from studying the endothelium itself and how changes in flow modulate the whole immunology, and I like to call this vascular immunology research. And we have everything from the MRI to the macroscopic part. And you just have to go to the discussions and watch or listen to the discussions at the end of the sessions. Lots of questions to these people. This environment has been just the perfect exchange between chemistry and biology and immunology and MRI. And I think this is the beginning. This is the seed of the interactions. Our next step is to go out and, for example, invite Markl to come from Chicago to Detroit and institute what he has on our system so that we can begin doing it on the cases that we have. And I think we'll see a lot of collaborations develop with different groups. Paolo's group and my group, we sat together and had breakfast the other day, brainstorming, and I think I see this all around the hallways, people talking here on what they're going to do next. So it's a nice environment to make that start happening.
Dr. Zamboni, you've been
Yes,
it before.
I think that one of the more extraordinary things happening here is the awareness that a lot of groups are exchanging, are studying different aspects of very complex, new, fascinating area. And I think that this is exactly the ingredient capable to give results in the next years in terms of better diagnosis and better treatment to improve the knowledge and everything we need to go forward.